SFA Foundation has invested almost $20 million in major mental health and well-being initiatives on the continent. We have a program that is being implemented in Zimbabwe with partners spread across the continent, and another program being implemented here in Nairobi that also involves partners across the continent. The program here in Nairobi is being implemented by Aga Khan University and led by world-renowned mental health expert, Professor Amina Abubakar, while that in Zimbabwe is led by another globally recognized African mental health expert, Professor Dixon Chibanda. In all, these programs and new ones that we are going to support, they encapsulate a number of principles, or I would say work packages. The first one is research funding and collaboration. The SFA Foundation provides financial resources to support mental health research projects focused on understanding the prevalence, risks, and cultural determinants of mental health issues on the continent. So such research can contribute to evidence-based interventions tailored to local contexts and improve mental health service deliveries and informed policy decisions on the continent. The second principle is a work package is capacity building and training. The SFA Foundation invests in mental health training and training programs, workshops and fellowships for researchers, healthcare professionals, and community leaders on the continent. This intervention aims to enhance the knowledge and skills of the workforce involved in mental health services provision, which will then lead to improve diagnosis, treatment, and prevention strategies in local communities on the continent. The third area is technology and innovation. The SFA Foundation supports the development and implementation of innovative technologies and digital mental health solutions on the continent. These include tools such as mobile applications, telemedicine, and online counseling services, which increase access to mental health service in remote and underserved areas. The intended impact is to reach or bridge the mental health treatment gap by reaching vulnerable populations and reducing barriers to accessing mental health care. Another area of intervention is community-based interventions, where we support a community engagement model that involves local stakeholders, including community leaders, traditional leaders, grassroots organizations, as we believe that by empowering communities and promoting culturally relevant mental health interventions, the impact would be to reduce stigma, raise awareness, and improve health-seeking behaviors, ultimately leading to improved mental health outcomes. Yet, another area of intervention is policy, advocacy, and implementation support. As the SFA Foundation, we collaborate with local governments and policy makers to develop and implement mental health policies and strategies, which will include advocacy for increasing mental health funding, integrating mental health into primary health care, and improving the policy and legal frameworks that protect the rights of individuals living with mental health conditions. The last area that the SFA intervenes in mental health is knowledge sharing and dissemination. We therefore facilitate knowledge exchange, conferences, research publications to disseminate research findings and best practices and innovative approaches in mental health. So by fostering global collaboration and sharing expertise, these interventions can enhance learning and adaptation of evidence-based practices in African countries that will generally lead to improved mental health outcomes.